So the last part is about the follow-up, timing of follow-up after discharge. We know that the Bhutanese charts were used on their own, but now the revision is that you correlate with how far below the phototherapy the baby is. So it's more easy, more clear-cut to follow. And you don't need an additional chart, you just need the phototherapy chart for the age of the baby. So the current guideline recommends using the difference between bilirubin concentration and the phototherapy threshold at the time of measurement to determine the interval between discharge and follow-up and the need for additional TSB or TCB. Other considerations that would influence the timing of follow-up include the risk factors for rebound, as we discussed before, the gestational age, postnatal age, assessment of the breastfeeding, weight loss from the birth weight, and assessment of well-being of the infant and the parents. So all these would play a role in your decision making. Suppose the jaundice is not that high, but the weight loss is high and the breastfeeding isn't established, it would still benefit them to come earlier. And of course, the weight loss and the poor feeding is a risk for the jaundice to rise as well. So the chart which we will show next is only applicable for infants at least 12 hours after birth and for the infants who have not received phototherapy before discharge. So if they have received phototherapy, you would follow the risk factor for rebound that we discussed before. And you would need to repeat 6 to 12 hours after they stop phototherapy. Any infant discharged before 12 hours should have a follow-up bilirubin measure between 24 and 48 hours of age. So the earlier they go, the earlier you bring them back for the follow-up. So this is the chart which is very helpful. So the starting point is more than 12 hours old with the TCB or TSB measured. Determine the hour-specific phototherapy threshold based on gestational age and the presence of a known neurotoxicity risk factor. Measure the TSB if the TCB exceeds 3 mg% below the phototherapy treatment threshold, or if it is more than or equal to 15. So all this is what we discussed earlier. If the bilirubin is at or above the phototherapy level, obviously you would begin phototherapy and follow the guideline. If it doesn't meet the phototherapy, then if it is within 2 milligrams of the phototherapy threshold and the age is less than 24 hours, you would delay discharge, consider treating these babies and measure in 4 to 8 hours. If the age is more than 24 hours, you consider repeating at 4 to 24 hours. Whether you measure at 4 hours or by the 24 hours depends on whether they are going home or whether they are observed in the hospital. And you could also consider delaying discharge and consider phototherapy and discharge with home if that is an option, home phototherapy. And if you discharge without phototherapy, you should be closely following up these babies. If bilirubin is between 2 to 3.4 milligrams, regardless of the age or discharge, review them by 24 hours. And 3.5 to 5.5, regardless of the age, you review them in 1 to 2 days. And 5.5 to 7, if they are discharged less than 72 hours, follow up within 2 days. TCB can be used also if it stays below the cutoff that we mentioned earlier. You can continue to monitor the TCB. And discharging more than or equal to 72 hours, clinical judgment can be used. Suppose you have seen these babies more than once in the clinic and the trend is definitely coming down. Even if the bilirubin is high, you don't need to keep seeing them. You bring them back around 2 weeks to 3 weeks of age, as we discussed earlier, to look for conjugated jaundice and follow the newborn screening result in these babies as well. If it is more than 7 mg% below the phototherapy threshold and they are discharging less than 72 hours, you bring them back within 3 days. And more than 72 hours, already their risk is very low, so you can bring them back 3 to 4 days or whatever. So usually we bring them back maximum 3 to 4 days after discharge, even if they are very low risk, just to make sure the other parameters are going well.